Welcome to the 3-Minute Clinic on Breast Cancer Awareness, and today we're going to be talking about the role stress, in particular the role emotional stress plays in the production and influencing breast cancer. Let's just review for a moment so we can get the big picture here. Remember, the most important thing is prevention. And when I say prevention, that's the purpose of, the doctors of preventive medicine, doctors of integrative medicine. They're here to empower you with ways to prevent disease. Remember, the difference is prevention versus intervention. When you have an illness, when you have a disease, one as a doctor has no choice but to intervene. We want to intervene, but not in an invasive way, not with drugs and surgery. We want to intervene in a preventive way so you can stay well. So the question becomes, first of all, is there a way to prevent breast cancer? And the answer to that question is yes. The second question is, what are the main factors that contribute to breast cancer? And as we talked about, breast cancer is a hormonal imbalance, a disorder, it's a hormonal imbalance. And what happens is the two main things, nutritional imbalances, in other words, biochemical, metabolic imbalances, nutritional imbalances, and emotional imbalances, stress-related factors, are the two things that contribute to the imbalances, contribute to the hormonal imbalances that produce the breast cancer. So today, let's review. What are we talking about? Does stress have an impact on breast cancer? The answer is yes. As a matter of fact, accumulated emotional tension, and this is what I find to be very common. As a matter of fact, if I was speaking to 85 of 100 women, ask them, do you consider yourself to have a high stress level, high, medium, or low? 85 out of 100 or so will tell me their stress levels are high. So emotional tension is something that's very common. And I'm not talking about getting upset or angry over misplacing your wallet or because your child, broke their plate or didn't have their meal. I'm talking about accumulated, prolonged, long-term stress. Stress in relationships, stress with parents, stress with children, stress with your loved ones, in particular relationship stress, because this is the key factor in the production of emotional stress and how it affects breast cancer. So what I need you to realize is this, that emotional tension and emotional stress lead to emotional imbalances. These imbalances go on to produce the breast cancer. So we need to be very proactive about it. We want prevention, we want to be proactive, we want to take charge, because we know one thing for sure from studying health and sciences, and we've got a lot of data on this now, that high levels of stress, in particular high levels of emotional tension, impair the immune system and cause hormonal imbalances. So what do we want to do? We want to get to the bottom of it. So here's what I need to make sure you understand. Long-term, unresolved inner conflicts, chronic worries, chronic resentment, buried anger. You see, when feelings get bottled up, when emotions get kind of choked off, when they build up inside of you, that's where the problem is. So here's the theme I want you to identify with. Here's the theme that I work with in most of my patients. When it feels right, it feels so right it can't be wrong. In other words, if you're not in that place where it feels so right it can't be wrong, if there's something that's not feeling right, it's significant. And if you don't feel right on a daily basis and that accumulates over months to years, or just 3 to 6 months, 9 months, something like that. Remember, it takes some 4 to 7 years for breast cancer to develop. So as stress accumulates, as emotional tension accumulates, this becomes hazardous to your health. So what I want you to do is to be able to identify how you feel emotionally, get in touch with your feelings, and above all, be honest with yourself, believe in yourself, and express yourself. You see, if you're not feeling right, it's not that there's anything wrong with that. Feelings aren't right or wrong. Feelings are. But if you don't express them, if you don't deal with them, if you don't communicate them, that works against you. So the thing for you to remember today is this, that high levels of emotional stress definitely play a role in the precipitation and triggering breast cancer. And the most important thing for you to know is that you have the power. You have the ability to make lifestyle choices to get emotional balance, for habits of happiness, to create more fulfillment in your life, to create more emotional fluidity in your life, to have emotional harmony with yourself, to be at one with yourself. That's the key. So what are the action steps to relieve your tension? What are the action steps you can take to make sure you're creating emotional balance? Well, try to acquire the habits of happiness. Learn how to express yourself. Above all, be yourself. And above all, find constructive ways to deal with your tension and your anger. And in doing so, you play a huge role. You go a long way in preventing breast cancer.